Hypertension in patients aged 50 and older. New guidelines on blood pressure targets and management of hypotension risk. The management of hypertension in patients aged 50 and older involves striking a balance between the cardiovascular benefits of lowering blood pressure, BLP, and risks such as hypotension and falls. Recent clinical guidelines and research data indicate that intensive control of systolic blood pressure, SBP, with target values below 130 millimeters of mercury and even down to 120 millimeters of mercury is more effective at reducing the incidence of major adverse cardiovascular events, MACE, including stroke, heart failure, and acute coronary syndrome compared to standard targets less than 140 millimeters of mercury, although intensive therapy does increase the risk of hypotension. However, it should be noted that many clinical trials exclude frail elderly patients with multimorbidity, which limits the generalizability of the results. Therefore, blood pressure targets should be personalized based on the specific patient's health status and priorities. Orthostatic hypotension is common among elderly patients with hypertension and is associated with an increased risk of falls. At the same time, the evidence suggests that well-controlled BP does not necessarily lead to an increase in the incidence of orthostatic hypotension, whereas certain classes of antihypertensive drugs, particularly beta blockers, may increase this risk. Guidelines recommend measuring blood pressure in the standing position in older patients, especially in the presence of diabetes or symptoms of postural hypotension, for effective risk management. Shared decision-making is a priority for patients with systolic blood pressure in the range of 140 to 150 millimeters of mercury and requires weighing the benefits of reducing cardiovascular risk against potential side effects, with closer monitoring of individuals with chronic kidney disease or high comorbidity.